Hello, class. My name is Professor Brandon Munson, and I would like to take you through a presentation on some of the latest data with the Affordable Care Act. Essentially, it's a 5-year retrospective since the act has been enacted as a law. And as many of you know, there is a tremendous amount of controversy over the um, over the law, and I think it was attempted repealed in the Senate just this last session, maybe 30 times. Um, so it's a real political issue, but nonetheless, it's here and it's here to stay. And so what I'd like to do is just take you through some of the most recent data. So one of the things that's important about the act is, although it's impossible to state with absolute certainty the full extent to which the ACA reforms have contributed to the nation's recovery, when you think about it, it was the worst recession in history, just short of a depression. Um, Overall, I mean, I suspect the balance of news has been good. Considering before the recession, data was showing the cost curve, well, the rapid rise of healthcare cost actually decreasing. In other words, still rising, but slowing. And that was data prior to the recession. So initially, a lot of folks um, associate the recession as slowing um, the growth of healthcare, but in fact, it was beginning to slow, beginning to slow already. Um, so I think what's important here is we have to look at what happened in terms of the GDP. And so we're looking at this chart, inflation adjusted GDP, and you can see that it's uh, grown quite steadily. We had you know, a situation right around here, but overall, from 2009 to third quarter 2015, we had a 13.8% growth in GDP, um, which is pretty significant considering what we went through. Um, Matter of fact, the healthcare sector gained roughly 1.4 million jobs since March 2010. Uh, what's interesting, it's mainly in ambulatory care, not nursing homes or hospitals, which, if you think about it, does make a lot of sense because there's a big move right now to really move away from institutional care because of the cost, and the outcomes aren't necessarily that great either. Okay. Here's the annual inflation adjusted growth in the U.S. economy and private investment 2010 2015. And you can see that the real GDP versus real private domestic investments, um, quite significant growth in the private domestic investment, which is a very good sign. When we, it's interesting when we talk about that. What, as you learn from Dr. Reinhardt's video, is that the growth in healthcare spending isn't coming from entitlement programs like the politicians like to claim. It really is coming from the private sector more and more. So to think about it in one way is that the ACA acts like an economic stimulus, in part by freeing up private and public resources for investment in jobs and production capacity. Moreover, the law's payments and other cost-related reforms appear to have contributed to the market slowdown in health spending growth seen in recent years as well. So, in other words, uh, it's 17% of our gross domestic national product. So that's a huge chunk of our industry. The only thing larger than that is essentially the defense industry. So it's a big part of our economic engine. But the reforms of the ACA at the same time have worked to slow down the costs associated with healthcare that many of us simply weren't able to afford anymore. So I think that's important to notice the difference between real GDP and private domestic investment. Okay, if we look at U.S. economic growth rivals or exceeds other high income countries, uh, what's interesting here is that we see uh, real GDP growth uh, from France, Japan, Germany, the UK, and Canada, and the US. Um, Pretty significant. I mean, the real engines are truly uh, well, the US, Canada, and Germany. Um, let's go on. Okay. U.S. jobs were up more than 13 million since 2010, 5 million above pre-recession peak. So that's pretty significant in terms of when we historically put um, what happened during the recession, which we're all still, have post-traumatic stress over, to really where we are now. So, for example, it shows here in 2008, um, there was 1,038,000 and then dropped to 129, and now we're at 143. So the U.S. economy has gained nearly 14 million private sector jobs over 5 years. All of the net gain in employment has been full-time work. You might recall that the way the ACA was written, there was like a 32-hour rule. And so everybody, not everybody, but skeptics, of course, said, well, what's going to happen is they're just not going to, if you, as an employer, if you have to offer insurance to your full-time workforce, then you'll just make everybody less than 40 hours to avoid that. Um, it's interesting, that's not the case. There are 5 million more people working now than during the peak level prior to the recession, and the unemployment rate has plummeted, of course. Recent annual gains in jobs have been faster gains than the 1990s. Still, labor force participation rates have yet to return to their pre recession peak, but we have to be realistic. I mean, what was going on there wasn't necessarily the truth. If you get a chance, there's a great movie you have to see, and it's probably got it wrong, but The Big Short. Excellent movie. They do a great job explaining what a mess that was. Okay. So when we look at inflation-adjusted economic growth in the United States in recent years, it has rivaled or exceeded that of many of the other high-income nations, and that's pretty much what we were looking at over here. Okay, here's our unemployment rate dropping, which is really significant because I remember listening to NPR mowing the lawn. And when we were sort of in this phase, it seemed like it was never going to change. This sort of from this point, I guess from I'd say 119 to I don't know, maybe 112 was going to be like this lost generation of people that were just going to be um, poor hobos walking around with no future. Um, I'm just so glad things like that don't happen. So when we look at that, we can see that things are definitely going in the right direction. We're back down almost 5%. Pretty spectacular. As we mentioned, U.S. private jobs increased by nearly 14 million, while public employment declined. So one of the interesting things when we talk about Keynesian economics, where we use the government throws more money into the system to spur investment because the private sector isn't doing it. There was a lot of criticism over that. That was a wrong thing to do. Um, well, it's always worked in the past, so why wouldn't it work now? And that's where he got the Tea Party from, and so on and so forth. Uh, which is fine. It's important to have those balances. The reality, though, is we're looking 5 years back, that stimulus was critically important to getting our economy back in shape. Uh, at the same time, the ACA was critically important in terms, it looks like, in controlling healthcare costs, which was a big driver of expenses for businesses just trying to get a handle on things, and then also people losing their jobs and losing healthcare and so on and so forth. But I think the takeaway here is that it was a myth. Um, we can see now that the government threw money into the system, private sector took advantage of it and really grew from it. Public sector eventually declined. And I'll give you a real life example. I was consulting for the Merritt Wallingford Independent Physician Association. Let's see, let's say around this time here. And when the American Reinvestment Act came out, there was this part of the provision was high tech, HITECH, and you can look it up. And high tech was critical because the whole point of it was to use part of the stimulus dollars to provide incentive for primary care physicians to purchase electronic medical records. Because the reality was, what we learned in managed care in the 90s was without real time data, you're managing finance, not care. In other words, you need to be able to see actual chronic conditions and be able to create predictive models, be able to truly manage care. So the government put a chunk of money into this initiative, and matter of fact, they created regional extension centers in each state, sometimes more than one, depending on the size of the state, where contractors, I became a federal contractor, and members of the IPA. And what we would do is we would assist physician groups in selecting and implementing certified electronic medical records. So, in other words, protecting the government's investment. Secondly, we were also responsible to help them get to what's called meaningful use. In other words, it's one thing to buy, it's another thing to use it, which is a real complex process, and it's one that's still going on, as you're aware of. And the real purpose of that is to have connectivity and bidirectional connectivity of patient information so we can make quicker decisions, lower costs through less errors, um, more efficient healthcare. And where we're stuck now is really the interoperability between EMRs. That's been a real sticking point. Um, DMRs can't do it, they're written in a certain language. A big part of the problem is that $45,000 given to the physicians to get to meaningful use might have covered an electronic medical record, but a bidirectional interface, for example, I'm looking to purchase one now to connect to the pharmacy for just for my organization, and it's $18,000. Um, so it's a racket. Anyhow, so that was around this time. So the stimulus money went to some pretty significant things, and that's one, for example, that will really pay dividends in terms of controlling healthcare costs. Let me see. Healthcare spending growth per person, both public and private, has slowed for 5 years. As I mentioned, it was slowing before the recession and slowing after it. Oops, net private jobs. Full time accounts for all net job growth from March 2000. So you can see the Affordable Care Act provision um, that many said would slow or people would lose their jobs didn't happen. Job growth has been similar for firms of all sizes. Uh, there's little growth seen in inflation adjusted average weekly wages. And that's sort of the thing we're looking at now is how are we going to get people paid more, put more money into the economy. Annual health spending growth slows to a rate of GDP. Um, A number of ACA reforms, particularly related to Medicare, have likely contributed to the slowdown of the healthcare spending growth by tightening the payment rates.